The proximal tubule is the portion of the duct system of the nephron of the kidney which leads from Bowman's capsule to the loop of Henle. Structure. The most distinctive characteristic of the proximal tubule is its brush border. Brush border cell equals, the luminal surface of the epithelial cells of this segment of the nephron is covered with densely packed microvilli forming a border readily visible under the light microscope, giving the brush border cell its name. The microvilli greatly increase the luminal surface area of the cells, presumably facilitating their resorptive function as well as putative flow sensing within the lumen. The cytoplasm of the cells is densely packed with mitochondria, which are largely found in the basal region within the enfoldings of the basal plasma membrane. The high quantity of mitochondria gives the cells an acidophilic appearance. The mitochondria are needed in order to supply the energy for the active transport of sodium ions out of the cells to create a concentration gradient which allows more sodium ions to enter the cell from the luminal side. Water passively follows the sodium out of the cell along its concentration gradient. Cuboidal epithelial cells lining the proximal tubule have extensive lateral interdigitations between neighboring cells, which lend an appearance of having no discrete cell margins when viewed with a light microscope. Agonal resorption of the proximal tubular contents after interruption of circulation in the capillaries surrounding the tubule often leads to disturbance of the cellular morphology of the proximal tubule cells, including the ejection of cell nuclei into the tubule lumen. This has led some observers to describe the lumen of proximal tubules as occluded or dirty-looking, in contrast to the clean appearance of distal tubules, which have quite different properties. Divisions equals, the proximal tubule as a part of the nephron can be divided into two sections, Parse convoluted and Parse Rector. Differences in cell outlines exist between these segments, and therefore presumably in function too. Regarding ultrastructure, it can be divided into three segments, S1, S2, and S3. Parse convoluted. The parse convoluted is the initial convoluted portion. In relation to the morphology of the kidney as a whole, the convoluted segments of the proximal tubules are confined entirely to the renal cortex. Some investigators on the basis of particular functional differences have divided the convoluted part into two segments designated S1 and S2. Parse Rector. The Parse Rector is the following straight portion. Straight segments descend into the outer medulla. They terminate at a remarkably uniform level, and it is the line of termination that establishes the boundary between the inner and outer stripes of the outer zone of the renal medulla. As a logical extension of the nomenclature described above, this segment is sometimes designated as S3. Function. Absorption equals, the proximal tubule regulates the pH of the filtrate by exchanging hydrogen ions in the interstitium for bicarbonate ions in the filtrate. It is also responsible for secreting organic acids, such as creatinine and other bases, into the filtrate. Fluid in the filtrate entering the proximal convoluted tubule is reabsorbed into the peritubular capillaries. This is driven by sodium transport from the lumen into the blood by the Na+/K+H base in the basolateral membrane of the epithelial cells. Sodium reabsorption is primarily driven by this P-type H base. This is the most important transport mechanism in the PCT. Secretion equals, many types of medications are secreted in the proximal tubule. Further reading, Table of medication secreted in kidney. Most of the ammonium that is excreted in the urine is formed in the proximal tubule via the breakdown of glutamine to alpha-ketoglutarate. This takes place in two steps, each of which generates an ammonium anion, the conversion of glutamine to glutamate and the conversion of glutamate to alpha-ketoglutarate. The alpha-ketoglutarate generated in this process is then further broken down to form two bicarbonate anions, which are pumped out of the basolateral portion of the tubule cell by co-transport with sodium ions. Clinical significance. Proximal tubular epithelial cells have a pivotal role in kidney disease. Cancer equals, most renal cell carcinoma, the most common form of kidney cancer, arises from the convoluted tubules. Other equals, acute tubular necrosis occurs when PTECs are directly damaged by toxins such as antibiotics, pigments and sepsis. Renal tubular acidosis occurs when the PTECs are unable to properly reabsorb glomerular filtrate so that there is increased loss of bicarbonate, glucose, amino acids, and phosphate. PTECs also participate in the progression of tubulointerstitial injury due to glomerulonephritis, ischemia, interstitial nephritis, vascular injury, and diabetic nephropathy. In these situations, PTECs may be directly affected by protein, glucose, or cytokines. There are several ways in which PTECs may respond, producing cytokines, chemokines, and collagen. Undergoing epithelial mesenchymal transdifferentiation. Necrosis or apoptosis. See also, urinary pole, brush border. Additional images. References. This article incorporates text in the public domain from the 20th edition of Gray's Anatomy, Wang T. Flow-activated transport events along the nephron. Current opinion in nephrology and hypertension 15, 530 Euro 6 doi, 10.1097/01MNH000242180.46362C4. PMID 16914967. ABCDE boron, Walter F. Bullpup, Emile L., eds. Medical Physiology, A Cellular and Molecular Approach. Elsevier Saunders. Pages 743. ISBN 978-1-4160-2328-9. Boron and Bullpup. Medical Physiology. Updated edition 2005. Boron and Bullpup. Medical Physiology. Updated edition 2005. Hypositoturia Overview or 2-ARP6B5 at eMedicine, ABC Reinc, Burton D. Rose, Helmut G. Renal Pathophysiology, The Essentials. Baltimore, Williams and Wilkins. Pages 132. ISBN 0-683-07354-0. Tomata Y. Early renal cell cancer. International Journal of Clinical Oncology 11, 22 Euro 7 doi, 10.1007 per second 10147-005-0551-4. PMID 16508725. External links, 1,771,700,264 ACP Notebook, Anatomy Photo, Urinary Cortex 1/Cortex 6, Comparative Organology at University of California, Davis Mammal, Kidney Cortex, Physiology, 77 CH03P14, Essentials of Human Physiology. The Nephron, Proximal Tubule, Parse Convoluted and Parse Rector, Swiss Embryology. Turinary Urine Hort 02.